Ms. Nelson, good morning.
Good morning, Representative Hughes. My name is Susan East Nelson, and I'm the Executive Director of the Louisiana Partnership for Children and Families. Let me start by saying that I'm not here to ask for money on behalf of myself or my organization. As a matter of fact, our organization does not take money from the state or the federal government in any shape or form. We rely on private donations and donors that give us funds. But I'm here today to talk to you about a crisis that we have in this state, and this is just the beginning. If the federal cuts that are coming through on Medicaid continue like we predict they will, we are going to see a dramatic cut to the federal funds that come to our state that take care of our most vulnerable citizens. And I will say that these are our most important citizens, the mamas and the babies of our state. Medicaid reimbursement rates remain woefully inadequate, resulting in extremely dire delays in accessing care and folks in rural areas having to travel enormous distances just to access a doctor or a physician that can meet their needs. I urge you to increase reimbursement rates for Medicaid and urge the Department of Health to invest in services that give us the biggest return on our dollars. Simple programs like home visiting, doulas, midwives, remote patient monitoring, things that cost us very little upfront and save us incredible savings on the back end by preventing things like high blood pressure after the birth of a child, bleeding that causes death in mothers, postpartum depression, and once again, things that prevent our mamas from dying while their babies are still young. These are things that cost us immense social capital in our state because now we have a child without a mother, and now we have to rely on a series of services to help raise that child without that mother. We have a maternal child health crisis in this state, and we can fix it with the right investments in the right places at the right time. I urge this committee to be comprehensively smart and increase Medicaid rates so that we can address these issues in the most financially expedient way possible. I appreciate your time today, and thank you.
Okay, Stephen Wright.
Good morning, Mr. Chairman, members. Stephen Wright, start on behalf of the Louisiana chapter of the American Academy of Pediatrics. I want to thank the administration, I want to thank LDH, and I want to thank this committee for its support this year and its initiative in regarding to bringing close to parity between Medicaid to Medicare rates on many primary care and preventative codes. Just to touch on all the things that were just mentioned, part of the reason that we have such the access problem that we have, part of the reason that we have trouble recruiting physicians to our state, especially to those areas that are in the most critical need, is to make sure that we can provide the competitive reimbursement that we need for them to be able to have solvent support to quality care for those individuals. This goes a long way towards that effort. I applaud you all. I ask that you continue to steward this through the budget process. I know that this is a multi-year plan that continues to move us towards parity with Medicare, and I think that this is a fantastic step in the right direction. I also want to pivot and thank Chairman McFarland and this committee directly in regarding to the mandate to continue addiction services funding in the upcoming year. I think what this committee did last year spoke very loudly and really spoke to our addiction community and what those needs are and helped us get back to a place where we can provide quality services. So please let me know and all the stakeholders here how we can continue to support you and your leadership on those issues.
Okay, Representative Marcel with a question.
Thank you. I'm sorry. What's your name, ma'am?
Susan East Nelson.
Susan. Okay. Thank you for being here. You mentioned federal cuts that was going to be disastrous for Louisiana. Can you be a little bit more specific and exactly which dollars you're speaking of that we're getting the cuts?
So we've already seen in the budget proposal from the feds in Congress that they actually have to make significant cuts to both Medicaid and Medicare because of what the budget process has initiated in Congress right now. I don't know that a lot of people know this, but I think about 80% of our LDH budget is Medicaid funding. So if those cuts have to be made, those cuts are going to come out of that federal funding that we receive from them.
Okay, and that would affect all of the programs that you all are talking about, Medicaid, Medicare, addiction, all of that?
Everything.
Yeah.
Absolutely everything.
Okay. Thank you very much. Because I've asked each department as they came up before us, what potential cuts were we looking at now? And everybody who came to the table said they were uncertain of what the cuts were
Well,
going to be. So
The House passed the budget last week, and
Okay,
in
so you're
Congress.
pretty
So
certain.
It's
Okay.
pretty certain what they have to do.
Okay, so it's going to affect the young, the most vulnerable people in our state.
The young, the old, the disabled, the folks that need our,
Right.
it's going to literally affect everyone who touches Medicaid in this state.
Well, thank you for being here and thank you for your testimony.
All right. Yeah, I want to highlight that it was the efforts of this committee on the addiction services. When the House Bill 1 came out, that those additional dollars were put in. It had been over a decade or longer since any additional resources had been given. We continue to discuss mental health as it relates to not just addiction, but to many other parts of our daily lives. And I think it's vital that if we're going to truly have a conversation about incarceration and other things, then the ability of the state to address the mental health part, whether it be through the addiction or other resources, is a priority. And I think we should do more, but at the bare minimum, do what we did last year. Any other comments?
No, sir.
All right. Thank you.
Thank you.